Hey everyone, I am joined today with a pelvic floor specialist, Dr. Dawn Andalon, and she has written the book, It's Never Too Late, The Hidden Truth About Aging and Menopause. This book is linked in the description below. You're going to want to buy it, so make sure you go check that out. We're going to hear tons of information, helpful information from Dr. Dawn Andalon. And so I bring her to you. She's the owner of level4pt.com, which we've got that on the banner here. So in case you want to go check her website out, if you're in the Encinitas, California area, which I'll let her give you more details on where that is. But Dr. Dawn, thank you so much for joining us. I really appreciate you sharing your expertise and your time with us.
Thank you. Yeah, super fun to do this and talk about my book a little bit more and also get to chat with you.
Yeah, thanks. Well, I read your book and it was so interesting for me to read because being a male and your book's on female health, especially menopause, as it says down there.
Yeah.
And I'm thinking about my family members that are of that age. My wife's too young for menopause, but I'm already giving her tips on it and telling her, you got to watch out for this and go to page this, go to check out chapter 2. You got to read this section. So it's been very helpful. And it's just awesome book. Good job on putting this together. But I wanted to know more about what brought you to the point of becoming an expert in this field and writing a book. So tell me more.
Yeah, I became interested in pelvic floor physical therapy, or women's health PT, as people call it, different things, back after I had my first baby. So now our first born is now 13. So 13 years ago, I struggled with my own issues postpartum, as do a lot of women. And even though I was a strong orthopedic physical therapist, there was a lot of things to do with that whole area of the abdominals, the pelvic floor, the areas that really need to recover after pregnancy and delivery. And I was trying to do my own research. Like, I should know this stuff. I know a lot about the muscles and the body, but I decided to go through special training and courses on pelvic floor PT. I was struggling with my own painful symptoms. We'll talk about this a little bit too, but having some bladder issues, having some pelvic pain, and also a pretty significant diastasis recti, which is where your abdominals actually thin and soften and separate. And it was really hard to recover after my second baby, who was 9 pounds. So when I went on this journey, I knew a lot about fitness and orthopedics, but it was really great to get trained more in pelvic floor because it's a huge part of female health and recovery, especially in postpartum, and for women that don't necessarily go through childbirth, but there is a lot of women struggling out there who are misdiagnosed a lot. So once I got into that specialty, I realized how many women need it at all stages of their life.
Yeah, you're so right. We see patients here in the clinic, and we're an outpatient orthopedic manual therapy based clinic. So we're seeing people with back problems and hip pain, sciatica, knee problems, that kind of thing. And when we get our ladies that are hitting menopause, and sometimes they'll share with us about their leaking problems or their prolapse problems, and I just have to raise my hands and go, you're talking to the wrong guy. I can help you out with the aches and pains, but as far as getting your pelvic floor stronger, besides, I feel terrible because I feel like I've probably given out some of the information, like what the doctors tend to do is like Kegels, but I always give it with a go see an expert, please. I am not an expert. I give them that caveat. So tell us more about pelvic prolapse, because I'm interested to learn more about that. I know so many women deal with that, especially with exercise. Oh, it's got to be so much trouble.
Well, sometimes women, they'll figure out they have it before they've even seen their doctor. So we get calls sometimes that is women freaking out, getting really concerned and frustrated because they start Googling what symptoms they're having. They feel like when they go to the bathroom, they start to feel something bulging there, or they feel like they're wearing a tampon that's kind of falling out, and it's really scary, especially if you start looking up your symptoms online, because I always tell people not to do that. But women will come to us with the concerns of what's happening. I feel like my insides are falling out. And really, we try to put them into ease and let them know there's a lot of things that you can do to help ease the symptoms. And in not all cases require surgery. That's, I think, one of the misconceptions of what happens when women have a prolapse and they think that's the only option. Or they go to the doctor and that's what they're recommended, to get a surgery, and they don't want to have a surgery. So yeah, and pelvic organ prolapse can be the vaginal walls start kind of caving in or prolapsing, the bladder, uterus, or rectal area, because they're held up by ligaments. Those ligaments can soften, and changes during menopause is a big factor too, that kind of softens those ligaments and causes the organs to fall down a little bit lower into the vaginal area, and sometimes even protrude out. And that's where women will start feeling their symptoms, or get that achiness in the lower abdominal area, sometimes pressure, heaviness. There's a lot of the common symptoms that we see that can be eased with the ways that we're treating them too. Or they're scared to do exercise. I think that's a big one too. And it's keeping people active and realizing there are ways that they can stay active and resolve their symptoms and get them better.
Yeah, staying active is such a big deal, especially to keep up the, just your fitness, your overall health, your weight management, which I would imagine probably just worsens the problem if you're not staying healthy and active. So it's like a self-feeding cycle, a vicious self-feeding cycle. Is that what you see a lot of?
Yeah, exactly. Like, women are afraid to be more active, but they actually need to be, because maybe they're trying to lose some weight, or they're struggling with, their identity and things that kept them highly motivated and kept their mood up. And they feel like, well, what's the point now? Like, this is really hard for me, or I'm going to make it worse, and I don't want to make it worse. So that's where in our practice we use Pilates as well. It's like a great way of training your brain to connect to your core and connect to those muscles down there. And it's not always about doing Kegel exercise. And I think that's a misconception too, because we find a lot of women with prolapse, they actually are tensing or over guarding their pelvic floor. And so it can actually make the symptoms a little bit worse. So there's many women that we help with, let's just get those muscles to calm down and relax and work on the normal function again before we start supporting and strengthening. So it's any muscle group in your body, you have to figure out what the proper, can it lengthen, but can it also strengthen too? And not everybody needs the strengthening. I think that's a misconception a lot too.
And that speaks to what healthcare professionals who are not versed in the pelvic floor, like, that's probably the go-to thing. That's my reflexive thought is, well, strengthen it. If something is leaking or not being held up properly by those pelvic floor muscles, strengthen it. And so I was so glad to learn that. Now I'm going to just keep my mouth shut in the clinic whenever it comes to this stuff, and just refer out to the right person. I wish you were in my town or I was in yours, so I can send them straight to you, and it's an easy car ride over, not a flight. But what I wanted to learn more about, because I bet there's viewers out there watching saying, do I have this stuff? And how do I get to a pelvic floor therapist? And what have I been going through? I want to know what your experience as a specialist, a pelvic floor specialist, has been with the patients that you're getting. What are they going through as far as doctor visits and trying different treatments out, devices? What do they typically go through before they end up getting to somebody like you?
Well, they're usually, I would say 1 out of 10 is probably recommended to go actually see a pelvic floor specialist. I think it goes across the board, where there's lots of gimmicks and gadgets, or they try to do these quick fix things. But if you're not going after the root of the problem and really supporting the muscles in that area, and it has so much to do with not just the pelvic floor, it's like your back, your abdominals, your breathing, your diaphragm. So that whole area, that there's so many ways that we can teach women how to protect it. And even if they end up having a surgery, because more of a severe prolapse, if it does require surgery, like, it just makes a world of difference if you're working with somebody that can help get to the root of the problem, which is usually has to do with the muscle support around there, that you're going to have a better recovery and you're going to have more success from surgery too. But many women are like, well, I'm too old, so I'm just gonna, get the surgery and that's it. Like, what's the point of even working with a pelvic floor physical therapist? Or they don't even know we exist until they start looking up things online. That's usually how we get clients, is because they start looking up their symptoms and they find a video or they find a blog or a podcast or something that we've done to be able to explain a little bit more about their body. And I think that's the most important, is like getting educated in all aspects so you really understand your body and what's going on. And it's not always that one thing is better than the other, but how we can have a more cohesive approach to really help support women with empowering them to understand their body and what might work, what might be a better option for them. Just as an example, I had a woman call me that was convinced that the only thing that she could do was do headstands, and that helped her prolapse. And I said, well, what happens when you're upright then? Like, you're standing and walking and moving around. And she was just convinced that's the only thing she needed, someone to help support her to get into like a yoga position to help it. And I said, yeah, that's going to be great, temporary, but are you interested in, solving the problem? Let's get to the root of the problem there. So it's just really, we hear all sorts of stories, and there's nothing that we haven't heard. So we always encourage women, like, be open and honest and transparent with us. And that goes with who takes our phone calls too, because they hear all sorts of stories. But
that's amazing. I can't believe she was doing headstands. I could see how it makes sense to help the situation out. Wow, that's nuts. Well, what kinds of tips could you give somebody over the internet like this on an interview that somebody can start to do like today, right now? Because obviously the best advice, I think, is go see a pelvic floor specialist and get examined and figure out what's going on, get the details to a healthcare individual who can specialize in this stuff, so they can give you the most precise advice and tell you exactly how to proceed through things. But that would be the best. But I think second best is what you have to say right now. What would you say is something that somebody can do for a pelvic organ prolapse?
Yeah. So we do virtual consults with people all the time too. I'm actually working on a program so I can teach women how to access this stuff on their own too, because there's a lot of times they can't find somebody in their area. And I just like to teach women and empower them on ways they can help themselves. But there are some tips of things if you tend to sit a lot, or you're sitting at a desk doing computer work, or you tend to sit on the couch a lot, you can definitely make your symptoms worse, because your muscles are going to tense up more the more you're in a sitting position. And I'm going to grab my model here. So if we think about this, like your pelvis here, so these are your hips, here's your spine. We have the pelvic organs that sit inside here. So it's like, these are your pelvic floor muscles. It's like a basket underneath your hip area. And when those muscles are, so if I show how you're sitting and you kind of sit back on your tailbone, so people that kind of curl their spine, or they're sitting lazy and they sit back on their tailbone, those muscles will actually tense up more, and it's more detrimental to having prolapse, because you want muscles to be able to support and stabilize and activate and be able to be called upon when needed. Like if you're walking or standing or squatting, that those muscles have to activate. But if they're used to being in a shortened state all the time, they're not really going to do their job. So I think posture is a huge part, and just thinking about getting over your sits bones when you are sitting, using a little lumbar support, something behind your back to get you upright, so you're sitting over your sits bones, and getting your ribs right over your hips, ribs over your pelvis. I think that's just one quick tip that we work a lot on posture and control of your posture in a sitting position, because that can make a huge difference. And getting up and down from your chair every 20 minutes, not sitting longer than that. So no matter what, with your back pain clients, you're probably teaching the same thing, but that can be a huge benefit to getting the muscles to be activated through your core and used properly, so they're not shortening and creating that extra stress on the pelvic organ prolapse too.
Yeah, you're absolutely right. And what I tell my patients with people that have to sit for a long time, like if they're in a desk job, or students as well, that happens a lot. But of course, you're talking about people with menopause symptoms. They've probably been sitting at a desk for decades. They're closer to retirement age. The frequent movement throughout the day is a big deal, just to activate muscles, because I feel like if you're just sedentary because you have to be, because you're working at a desk, the muscles just kind of relax and shut down in certain areas, which causes compensations in other areas. So
Yep.
you can get tightening in other areas, in other words. And just getting up and moving. I tell people, just set a timer every 15, 20 minutes if you can, whatever shortest frequency you can. Just fidget in your chair and move around, change positions, just to wake muscles up, be the fidgeter. So I agree 100%. I think that's a big deal. I never saw it though from the perspective of pelvic floor muscles. I'm thinking about like back pain and like hip joint pain, the ball and socket joint. That's great advice. Thanks for sharing that, Dr. Don. Appreciate it.
Yeah. Yeah.
So I want to know about who would most benefit from your book. Obviously women, but what are these women struggling with? Just so that if someone's watching this, it could be like, oh, that's for me, or I got to recommend this to my family member or my friend. What would you say?
Well, the book I wrote called It's Never Too Late, The Hidden Truths About Aging and Menopause, definitely for the 40 and up crowd. I would say anyone going in that perimenopause, premenopause to menopause and postmenopause and beyond. We're talking about some different things that have to do with how your body changes as you age. And I think the biggest thing is women saying that, oh, I'm past that, or I can't do that, I'm too old for that. And that's one of my pet peeves. So that's kind of the reason for the book. So having any bladder issues, back pain, sciatica, prolapse, like we talked about, or just feeling like you can't build muscle like you once did, different types of exercise if you're having joint pain or different aches and pains that come up, because we know how that is as we get over 40 and beyond. It's like every time you try something new, your body feels like it's breaking down and you get frustrated. So I would say anyone in that crowd that just wants to stay active and healthy, especially for a female over 40. And then my other book I wrote in 2019 is Beyond 9 Months. So that's more for the postpartum crowd, anyone that's had a baby in the last 6 months to a year and beyond, really, because I talk about some of the same topics, but in the aspect of postpartum care and how it's missing in the US, and the things that women can do on their own to help their body recover so they don't have some of these problems in the menopause stage.
Great. Yeah, thanks for sharing that about the other book. I've got it right here, Beyond 9 Months, and it's fantastic. This needs to be like a baby shower gift, I think, for a lot of people, just so that they know what to expect for new moms, or if they've already had a child or two. Because I have 4 kids myself. My youngest is 1.5 years old. My oldest is 10 years. And I've seen my wife go through a lot, and thankfully she's in great health. She doesn't seem to have too many issues, the things that she deals with here and there. She'd probably share more if she was here, but she's already taken a peek at this book. And I feel like the problems that start here when you're younger and having kids are what carry on to develop these problems that you hit when you're in menopause. That's the perspective that I'm getting here. So I love how you're covering the spectrum here with both books.
Yeah, I mean, if I see a woman in their 50s or 60s, a lot of times as we're talking about things and they're learning more about their body, they're like, well, this probably stems from when I had 2 C-sections 20 some years ago, or I didn't realize that was an issue because there just wasn't a lot of this education about pelvic floor health and restoring your body and more of the educational info there is now.
Yep. Well, thank you so much for joining us, Dr. Dunn. I really appreciate you sharing your knowledge, your insight. And so for those of you watching, if you want to directly connect with Dr. Dawn Andalon, let me put up the website here. You can get to her at level4pt.com. And on there, we were just talking before we started recording here, in the back of her book, she has that same website that I put up on there. And just so you can get a peek here. Oh, I don't lose it here. Here we go. All these books are available so you can get more detailed help on whatever you're specifically dealing with at that website. And then, as she mentioned, she's doing video consults over the internet, telehealth consults, so she can help you out that way if you're having trouble finding a specialist in your area. So you don't have an excuse. You can start fixing that pelvic prolapse problem. It's never too late to start fixing it. Or that incontinence problem, if you're having some leakage issues, you need to get that addressed so you can fully enjoy your life and be able to enjoy your relationships and exercise confidently. I love the example you give because I've seen it so many times here in the clinic. I'm afraid to jump on the trampoline. Oh, I hear that all the time. Yeah. And I hear it from the perspective of, I was already afraid going in to jump on the trampoline because I was going to leak. And then I hurt my knee on top of that. Oh, yeah.
But if you fix some of this stuff, then it'll help your knee pain, ankle pain, all that down the chain.
I just imagine the client that I'm thinking of, she was just so distracted with holding in her urine that she wasn't paying attention to her legs, and she's probably keeping her legs together and messed up her knee that way. Oh, yeah. Anyways, thank you so much. I appreciate it. And so go check the links out in the description below, guys, to get to these books. And we'll see you in the next video. Bye-bye.
Thank you.